So we are going to talk about NPS, or new psychoactive substances that have been known in the market by terms such as illegal highs, bath salts, and research chemicals even. Now, the term new psychoactive substances have been defined by the UNODC as substances of abuse, either in a pure form or a preparation, that are not controlled by the 1961 Single Convention on Narcotic Drugs or the 1971 Convention on Psychotropic Substances, but which may pose a public health threat. So, how dangerous are they? And what preventive measures can we take? To find out, today we are connected with the Public Relations and Protocol Chief of the National Narcotics Agency, or BNN, Police Brigadier General Sulisio Pujo Hartono. We also have MMC Hospital Psychiatrist Dr. Adhi Wibowo Nurhidayat. Thank you for joining us, gentlemen. General, Doctor, it's great to have you with us tonight.
Good evening. Assalamualaikum.
Waalaikumsalam.
Or on track.
Well, yes. We'll start with you, Dr. Adhi. Can you explain what new psychoactive substances actually are?
Yes, as you may know that drugs in the world controlled by internationally by UNODC divided in several groups. Some of the drugs didn't classified by UN Convention in 1961 and 1971, as you mentioned before. So these new drugs means that a new narcotics or psychotropics in the market, not controlled internationally, and it's we call it legal high because it's making people becoming high, but it's legal due to the law. So we are facing a new threat now because it's posing the public health security regarding health, and also we know that it's very dangerous.
So, out of curiosity, these are actually legal drugs that are being misused, or how many substances are currently classified as NPS? Still with you, Doctor.
Worldwide, we identified 1,100 NPS. But in Indonesia, when we discuss with the National Narcotic Boards, also the police headquarters, and some from experts from laboratory, we identified 88 NPS in Indonesia at present.
I see.
So it grouped into 9 groups. Some of them very famous in the youth. For example, Gorilla, Flapka, bath salts. Also, a new drugs we called like narkoba cair, liquid drugs. So gorilla cair, ganja cair, it's all in the market now.
So these are synthetic, right, Doctor?
Yes, but some of NPS actually are plant-based. You know that many of them, most of them, synthetic cannabinoid, synthetic catechinones, aminoindans, methadone, but some is derived or is a plant-based. You name it, kratom, khat, salvina dinoforum. So 3 of them plant-based.
So before we move on to General Sulisio, Doctor, I still have one curiosity when we are classifying these NPSs, right? Because some of them are also deemed legal highs because they're actually legal drugs. So are there some NPSs that are actually usually used for medication, for prescription medicine?
Some in the past, yes. For example, ketamine. Usually we use it in the operating room for anesthesia. But since so many people abuse it, now we very much control this kind of drugs, ketamine.
I see. Well, for now, thank you, Doctor, for the classification. We move on to General Solistio. Good evening, General. Thank you for your time with us today. What are the legal regulations that are in place regarding substances classified at NPS here in Indonesia?
If we say NPS, as saying by Dr. Adhi, it following in lieu with the single convention of narcotics in 1961. So thousands substances, either synthetic or semi-synthetic or plant-based, already included inside what we call Schedule 1, Schedule 2, Schedule 3, and Schedule 4. So still many newfound substances with the effect of narcotic, such as stimulant, depressant, and addictive, also still available everywhere. So if we following the definition stated by Dr. Adhi, many substances right now already included in the schedule of 1961, but several decades ago were considered as NPS.
I see.
The circulation of NPS in Indonesia is very interesting, because following the experience of PNN in the late of 2019, I think around December and early 2020, PNN ambush 3 secret lab in Tasikmalaya, Cilacap, and Semarang municipalities. Million pills says we got the information from many youth already intoxicated with the symptom, very severe symptom. They are sometimes when they consume, they feel dizzy, and they stand up and easily down, and stand up again and down, and cannot what we call communicate with the other person. So this configuration in the 2020 decline, and also in the 2021 and 2022. The most what we call popular NPS in Indonesia, as stated by Dr. Adhi, tobacco gorilla, and also other that we confiscated in the 2 regencies and 1 municipality in the late 2019 and the early 2020 are PCC. The PCC content are paracetamol and carisoprodol and caffeine. These 3 substances with different effect. The caffeine with the effect of stimulant, available everywhere, caffeine. Paracetamol also legal drugs, available everywhere in the drugstore market. You could easily find in the Alfamart or places. And the other one, carisoprodol is a substance considered narcotic inside what we call in Indonesia group 1 narcotic, so punishable more than for 5 years. And these three substances really terrible because they are the three substances. Sometimes when the stimulant effect rise, you become very happy and you have very strong. But in the other second, you will be very weak because of the carisoprodol effect substance.
I see. Well, General, we thank you so much for your clarification. We will have more information for you. We'll also continue this talk about NPS after the break. Gentlemen, we'll be right back with you, and viewers, stay tuned on See Today. We're still broadcasting from home on the Daily Wrap-Up. We'll be right back. And you're still with us on the Daily Wrap-Up, and we will continue our discussion with Dr. Adhi Wibowo, Nurhidayat, MMC Hospital Psychiatrist, and of course, Bapak Sulistyo Pujo Hartanto, BNN Public Relations and Protocol Chief here in Indonesia. Gentlemen, General, we stop with you, and I would like to continue one follow-up question. How does BNN track, the arrival of new NPSs circulating in Indonesia?
As we consider NPS are uncommon or is uncommon substances, circulation across the country could easily monitor by BNN because we have 173 BNNK and 34 BNNP. Provincial drug boards agencies. Usually, we got tip off from the bottom, from the people. The tip off, the lead of the people, then we follow up by looking at the chain of circulation, the transportation. Of course, we will question the victim, and then we track down until the secret lab. It's what we got in 2019 and early 2020. And sometimes we also got tip off from many other agencies, from Indonesian agencies, and also from other foreign agencies such as DEA, FBI, Austrian Drug Force, AFP, and other friend agencies in South Asia, and also from other countries from America and also from Europe. We cooperate very good with them. Every single tip of we consider important. So we analyze every tip off, and you know that we have a very good lab. So every information could be directly to track down until the user. So the similarity and possibility of the substance we found on ground will be checked out to the information and also sample from the lead agencies.
Right. General, thank you so much for the clarification. We'll be back with you shortly for one last question, but we have to move on to Dr. Adhi. Dr. Adhi, it was mentioned a little bit before, but what are the actual side effects of NPS usages, and how dangerous are they to users?
Yeah, in general, for the effect of NPS, usually we are facing the patient with agitation and aggressiveness. So it's very hard to deal with them at the emergency room or in the ward because they are talk very much and then making noise, quarrel with others, sometimes trying to hurt themselves or others, and even commit suicide. So it's a typical of NPS users, usually aggressive, and we cannot control it usually.
So when it comes to terms of addiction, is it how severe damaging can NPS addiction become in comparison to, methamphetamine and also marijuana addiction, for instance?
Yeah, for example, compared to marijuana, as you may know that the active ingredients of cannabis or marijuana is THC, tetrahydrocannabinoid. But for this kind of drugs, NPS, synthetic cannabinoid, in the market we know as gorilla or sun gokong or bagong. It depends on the region that they are selling. So it's different name, but the same ingredient, synthetic cannabinoid. The THC level is 75 up to 100 times compared to the cannabinoid, the marijuana. So you can imagine how hard it is, how strong it is.
So when there is a patient, an NPS user or addict, is medical treatment mandatory in curing NPS addiction, or can we cure it on our own?
Usually, we have to hospitalize the patient. Yeah, because it's very severe. It depends on the clinical condition. If they are the beginners, usually only we can make it in the outpatient setting. But after they becoming addicted, they are very aggressive. They have a problem with physical or even and mental hallucination, agitation, tachycardia, seizures sometimes, and even death. So based on my experience, usually I treat the patient hospitalized for at least a week.
So out of curiosity, how severe of an addiction must it be? Is there a possibility of vital organs being affected by long-term NPS usage?
Yes, because it's a very strong effect. It's a multi-organ failure usually, the liver, the kidney, and usually the brain because it's cause delirium. So even some of my patient came to the hospital, quarrel with the family, and hurting themselves and hurting others.
Well, Doctor, thank you so much for enlightening us with more information and on the effects of NPS and how dangerous they actually are, because those are synthetic, synthetic ingredients, you may say, that could be potentially, so many times more harmful than the legal dosage that is being distributed in the general public. I have one last question for you, General. How does the BNN educate and spread information about new psychoactive drugs to the public, especially students? Does the agency offer any programs designed for this task, or perhaps can we look up information online, or what drugs to stay away from and the most recent updates?
Okay. Actually, I want to add more information of Dr. Adhi, and later I will answer the question of Kay. I think this designer drug, I said designer drugs. NPS, new NPS that make in the secret lab very dangerous because of at least 3 aspects. One, very low price, very cheap price. In 1 tablet of PCC only sell out in the market for 10-20,000 rupiahs, 1 tablet. The second one of the time of production. The time of production is very limited because only need a very small space. You need only 1 building with space not more than 4 times 4 meters square. And the last is time of making. If we plan what we call old-fashioned drug like cannabis or ganja or maybe poppy flower, we the farmer need at least 4 months to plant and to grow. So the strength of the designer drug depend on the capacity of the pharmacist.
Okay.
The second one that I will answer the key question. We have 5 deputies in BNN. One eradication deputies, second one prevention deputies, empowering deputies, legal and cooperation deputies, and rehabilitation deputies. All together work in 1 team, accelerating the concept of war on drug stated by our chief, Komjen Pol Dr. Petrus Redat Goluse. He said in 3 strategy: hard power approach, soft power approach, and smart power approach. So for the hard power approach, we focusing the eradication of drug inside Indonesia, and also cooperate with the other agencies surrounding Indonesia, regional, Asian, also international agencies. We really what we call we really depend on the cooperation, collaboration of the person, agencies, bodies, universities, everywhere to assist BNN related to the prevention and empowering. Because of course, not only the task, the job of BNN to prevent the drugs, narcotic, but the job of this task to eradicate, the task to prevent the circulation of drug become the responsibility of everybody and all agencies in Indonesia.
Well, General, Doctor, thank you so much for your time. This was a very fruitful discussion, very informative. And please, both of you, stay safe. And thank you for doing what you do. And I hope that, more and more people are very much aware of at least the side effects and how dangerous these NPS are, so they won't even start trying. Gentlemen, thank you so much for your time. General, Doctor.
Thank you.
Till our next discussion.